The first case of monkeypox has now been confirmed in Wisconsin. What exactly are we talking about here? Joining us, as always, on a Tuesday, Dr. Jeff Potoff, UW Health Chief Quality Officer. I remember the first case of COVID very clearly because people thought, oh, now it's going to be all over. We don't think necessarily the same thing about monkeypox, do we?
No, I think monkeypox is quite a bit different. So monkeypox, typically not something we often see in humans. When we do, there's really two modes of transport. For this latest outbreak that we've seen in Europe and now in the United States, it really is mostly skin-to-skin contact. So your skin, your healthy skin, against someone else's skin who has these lesions, that's how we're seeing it spread. It can spread by droplet, but it's not as common.
Sometimes we can spread COVID not knowing we have COVID. You would know if you had monkeypox, would you not?
Most people are going to know if they have it. If they have a mild case, maybe they won't pick it up. But typically, to be contagious with monkeypox, you have to have those lesions on your skin. So it's just really important if you're going to be in skin-to-skin contact with someone, especially in this day and age, if you're in a high-risk social group for monkeypox, just to double check and make sure that that's not present before engaging in any kind of activity.
Gotcha. Let's talk more about coronavirus. BA.5, the dominant strain right now. We have less reporting from states and health departments on these cases. Any concerns with the lack of reporting on that, on where we're going?
Yeah, I think, slight concern, but not too much. I think in general, we do know that there's an underreporting of cases. What that then means, though, is that our decrease or our lower level of hospitalizations and deaths likely means that a lot of people are tolerating their infections very well. So we know that there's an underreporting. It may not matter as much if we don't see hospitalizations and deaths increasing.
The new COVID shots are geared toward Omicron. Too little, too late, or better to have some protection?
You just asked the million-dollar question. I do like the idea of these hybrid shots that have some general protection, but then some focused protection against what we think are going to be the most common variants during this fall. It's possible that we could get it wrong and that a new variant will emerge and these shots won't be uber effective. But if we get it right, it could offer really good protection for the community.
I want to go in a totally different direction for the last minute here, Doc. I would have no idea what to do if, God forbid, I was in a situation like the people in Highland Park were yesterday. But I know people tried to help. We're not medics, most of us. You're an emergency room doctor. Give me one or two things we should all remember in case, God forbid, we're ever in that situation.
I think there's a few things. The first thing is to make sure you're in a safe spot. You becoming another victim does nothing to help any of the current victims. The more victims we have, the harder it is to save everyone. But there are programs in the community that can teach you very basic skills. For the event that we saw in North Chicago, a program called Stop the Bleed, where you learn basic techniques to stop bleeding. It seems simple, but it can save lives. Lastly, if you're not sure what to do, make sure that you're not running to the hospital, trying to crowd the emergency department to find out more. We've got protocols in place. We know how to save as many lives as possible. Making our job as easy as possible is helpful too.
All right, get those courses. They are available, and we should do more on that. All right, Dr. Potoff, as always, thank you very much.